We're ready? Yeah, we're ready. Hi, how's everybody doing?
Hello.
Hello, everybody. Well, we have 30 minutes. We have a lot of information to share with you.
We are Cesar and Pam with cesarandpam.com.
Grow your business without selling your soul, your family, or your health in the process. And I made the promo video earlier today where I mentioned that many people still believe that we are in a health crisis with the virus. We're definitely under a financial crisis. We're going to talk about that too. But there's also a double standard that we want to talk about. And we welcome your comments. And we have a lot of information we'd like to share because we want to tell you what to do for your family. And if you have your own business, your home-based business, you're an entrepreneur like we are, it's actually a great time to continue growing your business without fear. And we're going to talk about it. A lot of the sources I'm going to use come from Heather McDonald. She's a fellow at the Manhattan Institute, contributor and editor of City Journal, lives in New York City. She graduated from Yale University, MA in Master's from Cambridge University, also law school from Stanford University. And she's talking about these three subjects, as I mentioned, the first one being about the health crisis. So it is clear now there was an overreaction about the virus. That has collapsed the lifeblood of the cities, which are the small businesses. By all the epidemiological models, okay, such as the Imperial College London model, on March 30th, they predicted 2.2 million deaths in the U.S. by September 1st. Well, it never happened. We have another video where we talk about a little bit more of the science and the numbers of how this virus is comparable to the flu in the numbers. And what has happened is that we have observed an unprecedented display of power by the government. There are three actors in the story that we're going to talk about today. One, politicians. Number two, health experts. And number three, the media. We have found the enormous peer pressure that has been created worldwide for politicians and for leaders and for media outlets to communicate a message. We're going to analyze that a little bit. It is the first time where public officials have required millions of lawful businesses to shut their doors, throwing tens of millions of people out of work in the US and hundreds of millions worldwide. And they did so at the command of these three groups: politicians, health experts, and media leaders. Here's the deal. So we heard about the common virus that was going to take over, and we have to be careful, right? But as new information started coming out, there was no balancing of what could have happened to the economy if we just completely shut everything down. And there's still a lack of understanding, I believe, of the long-term consequences of shutting down the economy. Arbitrary distinctions were made. Okay, we're going to let these businesses are essential and these are not. Well, to the worker, to the business owner, it's essential. But they started arbitrarily deciding wine outlets, wine stores, pot dispensaries can open up. Large grocery stores can open up, but not small ones. So the smaller businesses suffered the most. Medical offices were supposed to be shut down. So a lot of elective medical procedures started causing a lot of serious medical problems and deaths. Then we also have all the intangible effects of being shut down, of losing their job: depression rates, suicide rates, substance abuse, violence, domestic abuse, sexual abuse, all those things that also are not being carefully measured and weighed with shutting down the economy. So that's the first contradiction.
Yeah, and reading that article too, I was noticing how so many small businesses that were considered non-essential, they're the kinds of businesses that don't have like a lot of people going into them at one time. You know, it's small offices, small facilities where there's a few people that come in at a time. And we're saying, no, those have to be closed and no one can work there. But we have these large businesses, I mean Walmart or whatever, but where a large number of people, even though it's a limited number, it's way more people that are coming together in those areas than some of these smaller businesses, and it really doesn't make sense.
Yeah. Then we started, as time went by the middle of March, 2 weeks before the Imperial College model was published, Italian health data showed that the coronavirus was terribly lethal to a very small subset of the population, the elderly infirm, and a minor health problem to nearly everyone else who was not already severely ill. I mean, 25% of all deaths in the U.S. come from nursing homes. So now we turn the attention to nursing homes, as tragic as it is to lose someone. But how many of those, and we talked about that on our previous video, had comorbidity factors, other health issues that they already had? In Italy, for example, the median age of people that were dying was 80, and they died with nearly 3 comorbidities, such as heart disease and diabetes. The lead author of the Imperial College model has admitted that up to 2/3 of all COVID fatalities would have died from their comorbidities by the end of 2020 anyway.
Yeah, I think, we're not saying that there isn't a virus. We know there's a virus, and we know that people can get sick and people can die, but we're saying that we've seen a reaction, a blanket reaction that divides, has brought division, and has really negatively affected health. It's negatively affected our economy. And we need to look at what are some real answers. I listened to 2 environmental health and safety experts who between them have over 40 years of experience. And what do they work with? They work with one of the areas, in virology and immunology, things that they've studied. They are working to keep workers safe and healthy. And one of that is in the PPE, which is
personal protective equipment.
Yeah, wearing masks. And so there's so much protocol. We have agencies for over 50 years. We have established these agencies, OSHA, and I think it's NIA. There's another one.
OSHA, it's Occupational Safety and Health Administration.
Yeah, and the National Institute of Occupational Safety and Health. So at a state level, we have OSHA, then at a federal level, things to protect workers. And what they do is they make sure that people are wearing the right mask for the right task. And there's a lot that goes into it. They said you would be surprised. I mean, they have the research. There is the science behind wearing masks. But what have we done? We've just made a blanket mandate. Everybody just wear a mask. It doesn't matter. Wear a cloth mask, wear whatever. And they're saying, why? It doesn't make sense with what we know about science and what we already know about the coronavirus. We know that the size of this virus is tiny, tiny, tiny. It's incredibly tiny. 0.6 microns
go ahead.
Up to 0.125 microns. Okay, so I don't even understand all this, but it's so tiny that a cloth mask does nothing to stop it. It goes through the mask. So we're being told that we're protecting the people around us and we're protecting ourselves from the people, but it's not true. Scientifically, it's not true. And people are being shamed. It's creating so much division, so much hate. And it doesn't make sense. This is what these ladies were saying. It doesn't make sense because there's so much behind the science of personal protective equipment, wearing a mask. It's not just everybody put on a mask. That's why we have OSHA, because people were wearing masks and dust masks and working around particles and in their jobs where they were getting cancer, they were dying of respiratory diseases because they weren't wearing the right mask or there wasn't the right situation. There are people that put on a mask and they immediately can fall out, because it was the wrong mask. It's the wrong situation, or they have other medical issues.
Yeah, I was talking to my dad last week because it was his birthday, and he's a surgeon, and he was the director of a hospital for years and years, and he told me, put on one of those medical masks, and then light a match. If you can blow on the match,